In this video, I'm going to tell you about 4 exercises that have undergone scientific studies and are recommended by doctors to reduce low back pain. If you haven't been to our channel before, welcome. I'm Dr. Orlando Landrum. I'm a Harvard and Cornell trained MD who specializes in interventional pain, regenerative medicine, and neuromodulation techniques. Are you suffering from pain? Is it affecting your ability to be able to get around? Is it reducing the quality of your life? Would you like to be able to do something about it? Well, if so, I'm here to tell you that you have options. And those options don't just include cortisone injections, invasive surgery, or harmful opioid medications. I'm here to tell you that you have options and treatments that allow for you to be able to be empowered, for you to reduce your pain and be able to get back to leading the life that you deserve. On this channel, Cutting Edge Pain Relief, we explain those options so that anybody can understand. If you value this video and you think it's of good quality, by all means, please hit the like and subscribe button. If there are things that you think we can improve, by all means, please add that to the comments because we want to continue to get better to serve patients and people for them to be able to get back to leading their lives and doing the things that they really want to do. So on to this video. The things that we're going to talk about today are going to be things that involve exercises for low back pain and how to be able to get relief. And as I mentioned before, we're going to talk about 4 exercises. But before we get into those exercises, the things that we need to do is know a little bit about anatomy. And that aspect of anatomy is going to include us looking at muscles that provide postural stability. Postural stability muscles are going to be those things that form the core and the trunk. So when we look at muscles like that, they're going to be muscles like the abdominal muscles, which are going to include the rectus femoris, the oblique muscles, and then areas that are going to be present in the back and lower back musculature. So things like the multifidus, iliocostalis, the quadratus lumborum. These are muscles that help keep the spine erect and allow for patients and people in general to be able to ambulate, to move, and be able to do the things that you really want to be able to do without having pain and or problems with being able to have mobility. Then there are muscles that are involved with active movement, which some of those muscles overlap, as you can easily be able to see. The abdominal muscles, like the rectus abdominis, the aspects of the external oblique, internal oblique, and transverse abdominis that sit on the front portion of the trunk. And then aspects that are in the back portion are going to be things like the iliocostalis, latissimus dorsi, piriformis, gluteus medius, maximus minimus. Those muscles are going to be muscles that are going to be involved with active movement. So when we look towards exercise, we need to look at those muscles that have both relief for and strengthening of postural elements, as well as those that have components dealing with active movement. So our first exercise is going to include that of a supine bridge on the floor. Supine meaning that you're laying on your back, and the bridge on the floor meaning you're elevating your hips, in essence like a hip thrust. Included with this video will be all the scientific studies that are mentioned for each of the 4 exercises. The first comes from the Journal of Physiologic Therapeutic Science from 2015, which is a study that looked at 8 weeks of bridge exercises from patients that evaluated it with an Oswestry Disability Index, which is a measure of both pain and function for low back pain. And one of the things that they found was, at least according to this study, was the biggest problem for patients with chronic low back pain was lumbar instability. And instability can be one of the biggest factors in inducing all kinds of pain. And by reducing that instability, it was able to reduce pain and improve function. So some of the muscles of instability, which are improved with the aspect of a bridge on the floor, includes the rectus spinae, which is one of the deep muscles that exists from kind of the aspect of the top portion of the neck down to the sacral hiatus or in between the glutes. The muscles of the hip adduction, which allows for the legs and hips to be able to move outward, the gluteus maximus, and hamstrings. Those muscles provide major elements of stability, and when they're strengthened, as well as being able to put through postural restoration, it provides for improvement in pain as well as function. The second exercise is an exercise that is the single leg fallout, where the person lays on their back with their knees in a bent position, and they have one leg fall out to the side under direct control. The study that evaluated this particular exercise was the Journal of Back and Musculoskeletal Rehabilitation in 2015. And what they found is that individuals that had non-specific low back pain, what that means is patients that had diffuse or back pain that was present throughout multiple different areas in the low back, that frequently they had reduced hip rotation, and by improving and targeting muscles of the hip, it was found to have improved pain as well as function in the back as well as in the hip through using different strengthening exercises, including this one. And so one of the different muscles of the hip are going to include muscles like the obturator internus and externus, the piriformis, the quadratus femoris, the gluteus maximus, medius and minimus, and the psoas and sartorius. When those muscles are stretched and strengthened with this particular type of exercise, it has long-standing sequelae in a good way for improvement of back pain as well as function. Our third exercise is that exercise that's called a bird dog. And so as you can kind of see in this crawling baby, it's when you have the left arm up and the right leg out, or oppositionally, the right arm up and the left leg out. And it works a whole host of different muscles, but the study that looked at this was the Journal of Exercise Rehabilitation. And what it really found was that it affects pain control through deep muscle activation. And there are numerous muscles that are activated with the utilization of a bird dog. There's abdominal anterior aspects of musculature. There's posterior musculature that spans all the way from the neck down into the elements of the hamstrings. And so if we were to run through those extensively, they include the trapezius, which is the muscles of the upper back, supraspinatus, infraspinatus, subscapularis, teres minor, anterior and medial deltoids, which are parts of the shoulder, serratus anterior, latissimus dorsi, erector spinae, which are going to be components of the mid and low back, the rectus abdominis, the transverse abdominis, which are going to be parts of the abdomen, gluteus maximus, medius, and minimus, which are going to be muscles that sit within the gluteal portion, sacral regions, and elements of the hip, and they provide significant stabilization as well as active muscle improvement. So when that third exercise is put into place, you can be able to see considerable improvement in patients' posture as well as pain control. And our fourth exercise and final one is one of lower trunk rotation. What it involves is the patient lying in a supine position and both legs moving from one side to the other. The study that looked at this was the Journal of Orthopedic and Sports Physical Therapy, and what they found through RCTs, or randomized controlled trials, were treatment programs that focused on improved trunk musculature through stabilization led to significant improvements in both pain as well as disability, and also measures of quality of life. So trunk rotation musculature has two parts, one that's primary and one that's secondary. The primary muscles are going to be things like the rectus abdominis, transverse abdominis, and obliques, so muscles that are present within the abdominal wall. Secondary are going to be things like the rhomboids, deltoids, glutes, abductors, quads, and adductors. And so these are muscles that are present within the posterior chain as well as parts of the shoulder to be able to give strength and stability. So all of these muscles and these four different exercises provide ability to be able to reduce pain. So to reiterate again, they're going to be things like the aspect of the hip thrust. They're going to be that one single leg fallout. It's going to be the bird dog, and it's going to be the lower trunk rotation that allows for appropriate, significant, full evaluation of musculature that gives good pain relief and improvement in quality and function. If you find this video of value, by all means, please look at our website, Cutting Edge Integrative Pain Centers, as well as subscribe to our channel to get further information. Again, check out our page that will give you a newsletter that continues to give you further information and allows for individuals to be able to take control of their lives, eliminate their pain, and get back to doing the things that they want to do. Thank you so much, and have a great day.